Hi, my name is Polyzois. I'm a mechanical engineer at the Orthopedic Innovation Center in Winnipeg, Manitoba. At OIC, we support the medical device industry through testing, precision measurement, and clinical services. We were recently awarded funding from the governments of Canada and Manitoba to test N95 masks and PPE. PPE stands for Personal Protective Equipment. They are items worn to provide a barrier to help prevent potential exposure to infectious diseases. The different types of PPE include gloves, gowns, surgical masks with a visor attachment or an eye shield, respirators, face shields, and eye protection like goggles. All PPE sold in Canada for medical purposes are classified as Health Canada medical devices. Medical masks, N95 respirators, medical gowns, face shields, and medical goggles are considered to be Class 1 medical devices according to Health Canada, while medical gloves are considered Class 2. Classes are ranked by level of health risk to a person. Good question. A surgical mask, similar to this one, is a disposable Health Canada Class 1 medical device that provides a wearer protection against large particles, droplets, splashes, or bodily fluids like saliva. It also protects other people from droplets exhaled by the wearer through speaking, coughing, or sneezing. It is designed to meet the strict performance requirements outlined by the ASTM, or the American Society for Testing and Materials. And surgical masks should be used when users are unable to maintain physical distancing, at least 2 meters, between themselves and symptomatic individuals, despite existing engineering and administrative controls, and when a respirator isn't needed. Medical masks are not designed to fit tightly against the face, but should be adjusted to ensure nose and mouth are fully covered. They are used mainly by healthcare professionals. A non-medical mask, or a homemade mask like these cloth face coverings, or a bandana, is a disposable or reusable mask that is not designed to fit tightly against the face, but should be adjusted to ensure that the nose and mouth are fully covered. Health Canada recommends that non-medical masks be at least 3 layers thick to capture droplets of all sizes and aerosolized breath. So non-medical masks are intended to provide protection to others by containing the respiratory droplets or saliva exhaled by the wearer through speaking, coughing, or sneezing. Non-medical masks are recommended to be worn when it is not feasible to maintain physical distancing at least 2 meters between coworkers, customers, and the public where no COVID symptoms are present. Employers may have a policy that requires workers or customers to use non-medical face masks. Non-medical masks should be clearly labeled on packaging sold in Canada. A respirator, similar to this one, is also a Health Canada Class 1 medical device that provides a seal and a tight fit around the nose and mouth. It protects the wearer from exposure to biological aerosols that may contain viruses or bacteria and other respiratory hazards. It is designed to meet the performance standards outlined by the National Institute for Occupational Safety and Health, or NIOSH for short. Respirators are required when workers may be exposed to hazardous airborne substances like particulate vapors or biological hazards. These are not normally required for COVID-19 protection outside a healthcare setting like a hospital, unless the user is directly exposed to an environment containing aerosolized COVID-19 droplets, which could be possible when interacting directly with COVID-19 positive individuals in a closed space. A respirator is designed to fit tightly against the face and may be regularly fit tested by an authorized tester to a wearer's face. Each time the respirator is applied, it must be seal checked to ensure appropriate protection. The Centers for Disease Control and Prevention say that infections with respiratory viruses are principally transmitted through 3 different ways. The first is direct contact with an infected person, through touch or even a handshake or with a contaminated article or a surface. Studies have shown that the virus can live on surfaces for up to 72 hours after exposure. The second and most common way is through droplet transmission, or the spread of infection through exposure to virus-containing respiratory droplets or particles exhaled by an infected person through speaking or coughing, for example. This occurs typically within 2 meters of that person, and this is why social distancing is key in preventing this type of exposure. The third type of exposure is airborne transmission, or the spread of infection through exposure to small droplets or particles that can remain suspended in the air over long distances, usually greater than 2 meters, and time, typically hours. The CDC states that COVID-19 is spread primarily through respiratory droplet transmission within a short range. This is within 2 meters typically. In outdoor spaces, there is no evidence of efficient spread to people far away or those who have entered a space hours after the infected person was there. However, there are special circumstances where COVID-19 can spread by airborne transmission. These are an enclosed space within which an infected person either exposes susceptible people at the same time or to which susceptible people are exposed shortly after the infected person leaves the space. The second is prolonged exposure to respiratory particles generated with expiratory exertion, like shouting or singing or exercising, that increases the concentration of suspended respiratory droplets in the air space. And the third is inadequate ventilation or air handling that allows a buildup of suspended small respiratory droplets and particles. Great question. Health Canada and the CDC both recommend social distancing by at least 2 meters, properly wearing non-medical masks, frequently washing and sanitizing our hands, cleaning and disinfecting surfaces where possible, properly ventilating enclosed spaces, and avoiding crowded indoor spaces where circumstances can increase the concentration of suspended small droplets and particles containing infectious virus. Thank you very much.